Good evening. According to the Institute of Natural Resources, an integrated approach to rural development and to the conservation of our natural resources is long overdue as one of the most effective and desirable means of breaking the cycle of poverty and environmental degradation. It was an approach adopted by the Valley Trust some 35 years ago in what was then generally regarded as a unique and unconventional experiment.
Reflecting in microcosm the problems of the Third World, the legendary beauty of the Valley of the Thousand Hills is home to an estimated 70,000 Zulus. A dormitory for the surrounding urban areas, the majority of the population are nonetheless dependent on subsistence farming as a means for survival. Trapped in an endless cycle of poverty and ignorance, with high infant mortality and malnutrition rates, it was against this background that in 1951 Dr. Hallie Stott, a general practitioner and visiting physician at the King Edward VIII Hospital in Durban, decided to test his theories on rural upliftment.
Well, I looked around and the Valley of the Thousand Hills seemed to provide an ideal place to launch an experiment. Here you had, in microcosm, the universal problems of malnutrition, disease, diminishing food resources, environmental degradation, population explosion, escalating population, and it seemed to be an ideal environment to set up such an experiment.
Convinced that the answer lay in the development of agricultural and nutritional habits, he acquired a piece of land adjacent to the area and launched the Valley Trust, an experiment aimed at providing a prototype for improving the health and socio-economic circumstances of a black developing community.
Well, I was very concerned about the emphasis on curative medicine and the neglect of preventive medicine. I thought so much could have been done towards the promotion of health and lessening the enormous burden on the hospitals, the removal of people from their natural environment, where so much of the disease had its origin. This, I think, stimulated the idea of working up a scheme whereby I could perhaps relate the factors behind disease, so much disease, to a medical service. In other words, widening the horizon of a medical service in the environmental context.
The multi-sectoral approach of Valley Trust has been acknowledged as its key to success. Here, conventional medical practice has been combined with a variety of community upliftment projects. Dr. Ern Friedman, Valley Trust's present medical director, works closely in hand with the health centre, which is financed and run by the State Health Department.
Our emphasis here is on promotive care rather than curative care. The first immediate importance of that is that it's a much cheaper approach. Now, if I could give an example, the World Health Organization has adopted what they call GOBI FFF strategy for primary health care. What has motivated this is that approximately 40,000 children are dying each day throughout the world. They believe with a very simple strategy, which employs very simple techniques, they could save half of those children's lives. In other words, we could save 20,000 lives today. What we see is that health really is based on people's living standards. This may be obvious, but we know that as the health of a nation improves, so as their level of living improves, their health improves. And at the Valley Trust, we've taken what is called a basic needs approach. In other words, we think poverty is the underlying reason why people are ill. And for us, poverty is basically just being deprived of certain basic needs: food, water, shelter, housing, transport, education, that sort of basic thing. And our strategy here is to try and provide, in a very holistic way, some programs directed at all these different areas. Because we think if you only address one area, for example, if you had a feeding scheme at a school on its own, without all the other components, this in itself wouldn't improve the health.
A close and essential functional relationship exists between the health centre and the nutritional education unit. Here, patients are guided by Valley Trust staff into an awareness of correct dietary habits. This is complemented by an active gardening association who meet on a regular basis under the guidance of the Valley Trust Field Agriculture Officer to discuss communal gardening projects. the training program starts right on Valley Trust property, where a demonstration garden has been established. Senior Agricultural Officer Mr. Myeni discusses his work.
In this area is to teach the community the easiest ways of growing their vegetables in the health gardens in order to supplement and have a very good diet so that they don't have much diseases.
What is the soil like? Is it naturally quite barren?
It's quite barren, and when we started, it was totally eroded in as much that you couldn't grow anything. So through trenches and using a lot of organic matter, we've actually brought life to it. And the community have actually copied this, and they're practicing it at their homes. Most of the work is done out into the community. We visit the community because otherwise they don't have much time of coming to us, and they don't have much money to pay for transport. So we've got an extension team that goes out into the community, teach the people there, demonstrate there, then leave them to continue with the work, and then there will be a follow-up service all the time to check whether they've got any problems with their food production. There is a lot of improvement since I came in the area, because at the present moment we are having about 15 communal gardens with a little over 300 families involved in there.
I think if one looks around at our health service and at projects, there are very few around that are actually getting down to doing things. Now let's take water supplies. The vast bulk of the rural population don't have a protected water supply. They are getting water from dirty pools, from unprotected rivers. They are getting ill, and they're getting diseases like typhoid, cholera, and gastroenteritis, which, as I mentioned just now, is the biggest killer. Now, 60% of the cases getting to the hospitals have these preventable diseases. We spend a lot of money on hospitals, but we're doing nothing to improve water supplies, or relatively nothing. There is no national water-based program that I know of trying to correct this.
In common with development agencies around the world, the Valley Trust has been aware of the inappropriateness of most first-world technologies in solving third-world problems. Guided by this, they developed appropriate health technologies such as spring protection units and ferrocement rainwater tanks. These projects are done on request by the local community, who are expected to contribute financially and to take an active part in their manufacture and upkeep.
We're not here to give out food parcels. We're not here to give free gifts of food aid as we find in other parts of Africa. We are here as South Africans working with fellow South Africans to enable them to release their own resources as human beings and the resources in the landscape that we see around us. We are aware that they are working within the economic sector just over the boundary, so-called, in Pinetown, and yet they do not have the services that one normally associates with this type of close settlement. We're aware, too, that although we can work as hard as we can, we're a small group, and what are needed are far more resources in the way of roads, education, water, and so on. And without that input, there's no way in which we can expect the community to take off by itself, even with our very small assistance.
What kind of cooperation do you get from the KwaZulu government?
We work closely with them. We have a representative from the Department of Agriculture on our management committee, and through the local tribal authorities, who are part of the KwaZulu government, we are in continual contact.
Although the practical effects of such a philosophy are often slow to emerge, it has now been realized that this rate is nevertheless faster and the effects more permanent than is achieved by the more direct, high technology natural to the Western mind. Certainly success has been measured in the virtual abolition of nutritional deficiency in the Valley Trust area and the great decrease in hospital admissions. Recognition of the centre's works has come in the form of hundreds of visitors and trainees. And within South Africa, large numbers of similar programs are appearing throughout the lesser developed areas of the country.
We don't really need recognition for the work we do. What I think is much more important is for recognition to be given to the ideas that we're trying to promote. And these are not only our ideas. There's nothing unique about the Valley Trust in the sense that we're promoting things that are different from what is being promoted elsewhere. They're different in the sense that only the people involved in development seem to understand this, not the general public, and not possibly those who are spending money, and this is where it really counts.
In the final analysis, the success of the Valley Trust is testament to the vision of one man. How does he see the future?
I think the great thing is to see that the principles are not lost sight of. The principle of prevention, the principles of getting down to the root cause of disease. In this particular situation, where you have so many of these similar areas throughout South Africa, and I feel that they are ready for this type of approach. Decentralization of hospitals, as long as this happens, and spreading out clinics into the areas, taking your medicine to the people, but your medicine must in itself expand so that you've got education going on all the time, nutrition education, and extending itself to agriculture and the production of medically recommended foods in small gardens. They don't have to be large. This is not farming. This at least should almost be medical gardens. We call them health gardens. Now, this I don't think can go back, because I have witnessed a certain momentum now, the interest, the public interest, the enormous interest that's taking place here, and the trainees we're receiving from right throughout the country, I think are all indicative of the general acceptance of this philosophy and work.
By the by, Valley Trust is an independent organization reliant on public support and assistance from organizations such as Oxfam.